Hello everyone, I'm Dr. Shalini, working in the Department of Oral Pathology, PSM Dental College, Thrissur. Today I will be presenting before you a lecture on actinomycosis. I'll be speaking from an oral pathology perspective, and this lecture will hopefully benefit the undergraduate dental students. Okay, so let's start. So what is actinomycosis? Actinomycosis, if you go through the textbooks, it is classically described as a subacute to chronic bacterial infection caused by a bacterium of the Actinomyces species. So the term actinomycosis was derived from Greek, where actino refers to a radial symmetry, like something seen in a starfish or a snowflake, and mycos referred to mycelia. So as we all are aware, mycelia is a characteristic feature of fungus. So you would wonder why the term mycosis is being used for a bacterial infection. Way back when in 1845, von Langenbeck reported the first case of actinomycosis in humans, it was attributed to a fungus because of its morphological characteristic. And for a very long time, this was believed to be a fungal infection until in the 1960s when Waxman showed that actinomyces is a gram-positive bacterium and not a fungus. So yes, actinomycosis is a sort of a misnomer. So please remember, actinomycosis is a bacterial infection. It's not a fungal infection. Okay, so what are the microbial characteristics of actinomyces? Actinomyces is a filamentous, branched, non-sporing, gram-positive bacterium, which is a facultative anaerobe. It loves to uh, thrive in a microaerophilic condition. It is also non-acid fast, and it's a normal commensal of the oral cavity, gastrointestinal tract, and the urinary tract. In the oral cavity, it can be seen in areas like the tonsillar crypt, the gingival crevice, periodontal pockets, or even root canals containing necrotic pulp tissue. Around 30 species of actinomyces have been identified, but the most common species causing infection, especially in the oral cavity, is Actinomyces israeli, and the others being Actinomyces nislundi, Mary, Odontolyticus viscus, etc. So, how does a peace-loving, normally, a gentle bacterium residing in the oral cavity or in the other areas in the body go on to become pathogenic and cause an infection? So, it's evident that Actinomyces is a bacterium with low virulence, low pathogenicity. So a breach in the oral mucous membrane or in the epithelia is necessary for the organism to gain entry into the deeper tissue and establish an infection. Also, the presence of devitalized or necrotic tissue assists the organism in establishing an infection. Another factor which enhances the relatively low invasiveness of actinomyces is the presence of the co-pathogens. It's been observed that most of the times actinomycosis occurs as a polymicrobial infection. The presence of other microorganisms like Actinobacillus concomitans, Prevotella, Staphylococci and Streptococci, all these organisms, they help or they act in a synergistic manner by elaborating a toxin or by forming enzymes like hyaluronidase, which facilitates the entry of actinomyces into the tissues and invasion into the adjacent areas along the tissue planes, and also sometimes by inhibiting the host defense, or even by lowering the oxygen tension in tissues and hence providing a conducive environment for actinomyces to thrive. And once the infection is established, there is a host response which adds on to the pathogenesis of the infection. So the intense inflammatory response by the host leads to a kind of a suppurative, initially a suppurative, and then slowly it progresses onto a granulomatous type of infection, and finally it can also lead to fibrosis of tissues. Okay, so these are the risk factors or the predisposing factors. Logically, you can think of poor oral hygiene and maxillofacial trauma like fractures or gunshot wounds, or the patient will very often give history of a preceding dental extraction or any kind of minor surgical procedures. Okay. Even though actinomycosis is not an opportunistic infection in the true sense, because it is mostly seen in healthy individuals, but many times it's also been associated with HIV infection or patients who have undergone transplantation, chemotherapy, or patients with other systemic illness, nutritional deficiencies. Okay, so how does the disease manifest itself? So, actinomycosis has been categorized into three types or three forms depending on the affected site. Okay, so the most common form is the cervicofacial form, which forms 50%, which accounts for the 50% of cases. The second form is the pulmonothoracic form, and the third one is the abdominopelvic form. Since cervicofacial is the most common form and it is the most relevant to us, my discussion will be focused on this type. But yes, the general features, the histopathological features, the diagnosis are common for all the types. Okay, only the site will vary. This disease can affect people of all ages, but it's mostly seen in young to middle-aged adults, and for some unknown reason, men seem to be more affected than women, except for the pelvic form of actinomycosis, where the use of intrauterine contraceptive devices act as a risk factor. No racial predilection has been observed, and yes, it's seen in people in lower socioeconomic strata and people with poor dental hygiene. Okay, so what are the clinical lesions like? Okay, so this actinomycosis has a very typical presentation, and the most common site affected in cervicofacial actinomycosis is the perimandibular region. It will manifest as tender or non-tender, multiple nodular lesions. You can see the pictures over here. You can see this nodular lesion with the cutaneous surfaces showing multiple draining sinuses. Okay, so nodular lesion which has a sort of woody hard consistency. So the term lumpy jaw has been described as has been used to describe the manifestation. So you can see in all these pictures there is the nodular lesions, mostly multiple lesions, and another characteristic feature is the presence of sinuses, multiple draining sinuses. Okay, sometimes it can also present as acute disease with a rapidly progressive painful mass, but the most characteristic feature is the discharge of the pus, which contain a very characteristic appearance, which has a very characteristic appearance, and that appearance is called as the sulfur granules. All of you in your chemistry labs would have handled sulfur, and how does it look? Sulfur it's a yellow powdery substance. So the pus which is extruded or which is seen in actinomycosis, you can see here, it shows these kind of yellowish gritty material of approximate size 0.1 to 1 millimeter, which can be seen with the naked eye. And these gritty particles have been called as sulfur granules because of its resemblance to the sulfur. Okay, so 40% of the cases present with sulfur granules, and it's quite pathognomonic of the disease. All right, so if you leave the disease untreated, it will slowly slip into a chronic phase, which will lead to a granulomatous reaction, and then subsequently it will lead to fibrosis. This another hallmark of the infection is the ability of the infection to for contiguous spread. Okay, most often it spreads to the adjacent, or it invades into the deeper tissues, or many a times defying the tissue planes, and it can even enter into the bone and cause osteomyelitis. So osteomyelitis of mandible, more commonly, or the maxilla, it's one of the most common complications of the disease. Uh, in addition to the extensive cutaneous scarring and disfigurement caused by the multiple draining sinuses and fibrosis. In very extreme cases, hematogenous dissemination is also possible, leading to more serious conditions like meningitis, brain abscess, and involvement of other internal organs. Okay, so how do we go about diagnosing actinomycosis? Actinomycosis can be diagnosed by culturing the organism, but it's seen that it's difficult to isolate and culture the Actinomyces. The reason can be because it's an anaerobic organism. You need stringent measures to collect the specimen and culture it. The second reason can be, as I previously mentioned, it's most often seen as a polymicrobial infection. So it is difficult to isolate only the actinomyces and uh, grow it on a culture medium. But it is possible. You can collect the pus or the aspirate, and you can culture it on the brain heart infusion agar media, or the chocolate blood agar, or the thioglycolate medium. And the cultures are characteristically seen like this. You can see that the colonies resemble a molar tooth. It's called as a molar tooth colony, which grows on the agar, and that is for the Actinomyces israeli. Actinomyces odontolyticus, it forms rust brown colonies or red colored colonies. But an easier way is to go for stains. All right, you can get the pus or the aspirate, and you can separate out the sulfur granules. You can crush these granules in between the glass slides, and you can use these stains to demonstrate the bacterial colonies. You can see how beautiful these colonies look on the H&E stain. This is PAS. The Gomori methylamine silver stain, or the Gram stain. Okay, so the colonies or the microbial colonies can be demonstrated by using these the stains. More recent advanced diagnostic methods like the nucleic acid probes and the PCR test can also be used for diagnosis. You can even take biopsy. You can either take the aspirate or the biopsy or the pus, and you can observe the microscopy, which is very characteristic. Okay, so the histopathology, you can see very characteristic colonies. The sulfur granules will appear as these kind of clumps or colonies, which will stain hematoxyphilic. You can see it as radiating hematoxyphilic filamentous appearing structures, which is surrounded by numerous neutrophils. All right, so you can see that actinomycosis is characterized by a mixed suppurative in the initial stages, and later on a granulomatous inflammatory reaction, which is also associated with connective tissue proliferation. Okay, so the granules can be seen as cauliflower-like clumps with radiating filaments, and which seem to be floating in a sea of neutrophils, the polymorphonuclear neutrophils. This is a characteristic appearance of actinomycosis. Another thing which you can see is called as the Splendor-HOEPPLI phenomenon. Okay, so you can see how the colonies look with gram stain. You can see this gram-positive filamentous organisms over here, and it's very evident in the GMS stain, where you can see these black stained filamentous conglomerates of the bacterium. Okay, another characteristic feature is something called as the bacterium has been described as ray fungus because of this characteristic appearance. Okay, so you can see this is the colonies which have taken up the hematoxylin stain, and on the periphery, very characteristically on the periphery, you can see some radiating club-like structures, okay, which takes up a eosinophilic stain. Okay, so this is very characteristic, you can see that, and these are the neutrophils. So in the background you can see the neutrophils. So you can use this diagram to show the histopathology of actinomycosis. You can draw this radiating kind of microbial colony with an encrusting of an eosinophilic material and surrounded by the neutrophils in the immediate vicinity of the microorganisms. Towards the periphery, the type of inflammatory cells are different. You will see lymphocytes, you will see macrophages, you will see multinucleated giant cells. All right, so this is more like the granulomatous infection. Okay, and in long-standing lesions, you will even see fibrosis of the tissues on the periphery. Okay, so you can see this kind of an appearance, the radiating appearance. So the term sun ray appearance, okay, is used. So this is the histopathological sun ray appearance. Please do not confuse it with the radiological sun ray appearance which is seen in the osteosarcoma. Okay, so this is histopathological appearance which has been likened to a sun ray appearance, and it's also been called as a ray fungus because of this. Okay, so the eosinophilic encrusting that I mentioned, the presence of such an eosinophilic material, it's called as the Splendor-HOEPPLI phenomenon. Okay, so I'll just explain to you what do you mean by the Splendor-HOEPPLI phenomenon. The Splendor-HOEPPLI phenomenon refers to the deposition of an eosinophilic material around the colonies of microorganisms. So here you can see that centrally you have the filamentous microbial colonies, and on the periphery there is an encrusting of an eosinophilic material which is nothing but the antigen antibody complexes. All right, so this phenomenon is not specific for actinomycosis. It is also seen in other infections, fungal infections like sporotrichosis, or bacterial infections like botryomycosis, etc. can see exhibit this kind of a phenomenon. So it is the eosinophilic club-shaped structures. It's because of the deposition of the antigen antibody complexes and also debris from the host inflammatory cells. All right. So that this is the histopathology of actinomycosis. It has a very characteristic appearance. All right. Okay. So how do you manage case of actinomycosis? Actinomycosis, it responds, most of the times it responds well to antimicrobial therapy, and the main choice of drug is the penicillin. Initial intravenous course of penicillin followed by a long-term, 6 weeks or even sometimes up to 6 months of oral penicillin. Uh, Many a times, surgery is also indicated as an adjuvant, uh, mainly where there is presence of fibrotic sinus tracts which do not spontaneously resolve after the medical therapy. Okay, so to summarize, actinomycosis is a very interesting infection. It presents with different manifestations, all right, but mostly it's a slowly progressive, suppurative, characteristically suppurative, and in later stages chronic granulomatous disease. It is endogenous in nature, and it is non-contagious. You see, the bacterium is endogenous, so the infection is also it happens endogenously. Uh, Another hallmark of the disease is the ability of the infection for contiguous spread. Spread often happens to the adjacent tissues, and many a times the tissue planes are also not followed. Okay, it evades the tissue planes. Uh, so proper diagnosis is important to avoid the complications. Um, if the disease is left untreated, it can lead to um, disfigurement or invasion of vital structures, blood vessels, or hematogenous spread, causing more serious conditions. Okay, so from exam point of view for the students, this topic can be asked as a short essay, or it can be asked in parts as a short note. Only the histopathology of actinomycosis or just the clinical features of actinomycosis can be asked as a short note. So make sure that you describe the clinical features, the histopathology properly, and also draw a diagram for the histopathology. On that note, I conclude my lecture. Happy learning and thank you.